Hashimoto's thyroiditis. Is your thyroid problem really an immune system problem? I'm Dr. Martin Rutherford. I am a certified functional medicine practitioner, chiropractor since 1979.
Dr. Randall Gates, board certified chiropractic neurologist, as well as being a chiropractor.
And for those who haven't seen us ever, those are two separate disciplines. They are functional disciplines. And these are the two disciplines that helped me to recover from a number of chronic problems that I had developed. And so we have put them together into one paradigm and ultimately have developed a chronic pain practice. Thyroid has been a ginormous part of figuring out chronic pain. And I could go on for hours about the tales of thyroid that we've had even before you got here, even the craziness of before you got here. The doctor from whom I learned most about thyroid initially was a Dr. Datis Karazian, who you've heard me mention. And in my earlier days, I kind of had a straight line to him when I was trying to see patients and didn't know what I was doing. And I kept seeing these difficult chronic cases of chronic pain. And finally, after about a year or 8 months or whatever it was, I called and said, what's going on with this case? And he said, did you ever look at the thyroid antibodies on this case? And this was like the 6th time I had said no. And he said, well, don't ever call me again on a chronic pain case until you have looked at the antibodies. In fact, if you're not going to look for the antibodies, don't even call me again. And then this was just right before you got here. I started working with another one of his associates, and the next 10 patients that came in, we did the antibodies on all of them. Like 7 or 8 of them had positive thyroid antibodies. You're going to see why that is today. But the point being that this was a while ago, and at that time we were getting a lot of flack for even looking for Hashimoto's thyroiditis, because at that point Hashimoto's thyroiditis was not even on the radar. And this wasn't that long ago. 7 years ago.
Right.
7 years ago.
I've been with you for 6.
Okay, so 7 years ago.
A little more than 6.
And so now we're going to find out some interesting stuff about some new novel treatments that are being put together. But we had a patient last week, I think, who was very interested in knowing about Hashimoto's. So I sent her to our website and said, we have all these talks online, and look up Hashimoto's. And she sent us a note that said she couldn't find it. We do have one that is called, back in March of 2014, it's called Hypothyroid and Hashimoto's.
Okay.
We do have one.
Okay.
But most of them are just subclinical hypothyroid, subclinical hypothyroid, or hypothyroid in this and hypothyroid, because that's the way it's referred to in the literature. Right. And that's the way your endocrinologists refer to it. So this is an interesting subject. I wrote an article about 6 or 8 months ago and researched some articles to give me some validity in that article. And one of the things I researched was that communique from the Mayo Clinic. Granted, it's 6 years old, but nothing seems to have changed. We see people from the Mayo Clinic that have been to the Mayo Clinic, not that they send them to us. And the communique basically said, we don't know what to do with subclinical hypothyroidism. We need a national double-blind study. It needs to be government supported, because we don't know what to do with it. And in the body of that communique that they had sent out to their doctors, they noted that 80 to 85% of those subclinical hypothyroid patients had antibodies against their thyroid, meaning they had Hashimoto's. And since then, LabCorp has indicated.
In frank hypothyroid patients, 95% have antibodies to the thyroid. Right. Yeah, exactly.
Right.
Yeah.
I think they said 85. I think LabCorp said 95.
Yeah, LabCorp says 95 for frank hypothyroid patients, and Mayo Clinic says 80 to 85 for the subclinical group.
Okay, all right. So we'll talk about that. And so this is still a misunderstood subject. I've had several thyroid patients come in just recently, one just the other day, and had been diagnosed with Hashimoto's. And we had the patient who was coming here from Brooklyn, who was diagnosed with Hashimoto's, and clearly
nobody's really
their doctors
attacking that.
maybe weren't really up to date on what to do for Hashimoto's based on reviewing their records and talking to them. So let's get you up to date on it. Is your thyroid problem really an immune system problem? So an overview of today's broadcast.
In essence, we have a lot of people will take thyroid medication, they feel better. So we're not really talking about these patients as much, but there seems to be even a greater majority that come into our practice who are on thyroid medication and they don't feel well. They still have persistent thyroid symptoms. And that's why the book by Dr. Rutherford's mentor, Dr. Karazian, has exploded. And it's called Why Do I Still Have Thyroid Symptoms When My Lab Tests Are Normal? It was published, I don't know, 7, 8 years ago?
5.
No, because it was published before I even got here. So it had to be somewhere around 7 years ago, I think. Okay. And so it was published a long time ago, and the data has changed from then to now that we're going to go through. But the premise is the same in that many people are missing the notion that the immune system is actually the cause of most hypothyroid cases. And then there are a lot of people out there who have thyroid symptoms and they go to their doctor and they may test normal in terms of their thyroid, but they actually do have an autoimmune attack against the thyroid termed Hashimoto's, but that's not being investigated, likely because their insurance isn't going to pay for those tests to be run, or the doctor just doesn't feel it's necessary because they're either going to give you a thyroid medication or not.
Not going to change treatment.
So we're going to go through all that today in our broadcast, and we're going to talk about the current model of how we treat hypothyroidism, as well as the iceberg that's kind of being missed that we feel relative to this whole Hashimoto's discussion.
Now, thyroid is a very, very complex problem. As I was reminded by one of the local endocrinologist's wives on Facebook one day, when she wrote that we shouldn't be taking care of it because it's complex and you should go to an expert who wasn't able to take care of hypothyroid problems. And but that book that Dr. Gates talks about, I think there was over 500 references in that book, maybe as much as like 700, but there were a lot of references in that book on thyroid, which really the book's about. It's mostly about Hashimoto's. And that was 7 years ago. And that was 7 years ago.
And what I'll interject right there is that we've done 3 broadcasts in the last year. We did one in January of 2015. We did another one, I think, in August of 2015. And now we're doing this one. We've done others aside from that. Just in those 3 broadcasts, we have about 130 to 140 references for these 3 broadcasts. I attached 40 to today's broadcast. So there's a lot of data.
Yeah, so it's not like we're making this stuff up, or it's not like it's unknown, and you're going to get the people out there, we're going to be yelling, oh, do the iodine thing, do the selenium thing, listen to us. So I'm going to say, this is what we do. We had to understand chronic pain to get where we are as far as getting the results that we're getting in chronic pain. There was a handful of keys to understanding the enormity or maybe the complexity of the multiple vicious cycles that are involved in chronic pain. What we're about to talk about is one of those big breakthroughs in understanding that Hashimoto's thyroiditis is, as Dr. Karazian told me years ago, everywhere. I have it. Yes, I have it. I have it. So I have an understanding of it from that perspective. And you're going to have an understanding of it by the time we're done. So do you want to go through hypo versus hyperthyroidism, or you want to go through the whole thing of thyroid relative to gut and conversion? Or
I'm just going to do a general overview. This is going to be a general overview. If you want more specifics, go back and watch our other thyroid broadcasts. In essence, the brain sends a chemical to the thyroid, which sits right here below the Adam's apple, telling the thyroid to make thyroid hormone. That's called TSH, and that's what you're going to see in your lab tests. So if the thyroid cannot make enough thyroid hormone, then TSH will go up because the brain is going to send more signals to the thyroid. So that confuses a lot of people. They think my TSH is up, so I have hyperthyroidism. No. If your TSH is up, you have hypothyroidism. If your TSH is down, below normal, then you have hyperthyroidism. So the thyroid gland makes largely inactive thyroid hormone. It converts basically iodine and hydrogen peroxide via the thyroid peroxidase enzyme into inactive thyroid hormone, labeled as T4. And then T4 will circulate throughout your body and will be converted into T3, which is active thyroid hormone, primarily in the gastrointestinal tract and the liver. There are other sites for conversion, but that's where the majority of it happens. So from that, you can probably tell that alternative practitioners will look at the gastrointestinal tract and liver function intensively to see how that thyroid is being converted from inactive thyroid hormone to active thyroid hormone. That's simply thyroid physiology, and then both inactive and active thyroid hormone levels feed back to the brain so the brain can see how much thyroid hormone is in circulation, and it can adjust the thyroid's activity via the TSH. That's thyroid physiology. And if you have hypothyroidism, the standard medical model is to put you on T4-based therapy. That's levothyroxine, that is Synthroid. These are the common medications that are used. Some practitioners will use combinations of T4 and T3. These are more traditionally like alternative practitioners. They'll use Armour thyroid, which is basically a glandular thyroid from an animal. And it has T4 and T3 in it, but it also has thyroid tissue from an animal in it. So we've seen some patients who take Armour and they end up having autoimmune reactions to the Armour because they're already attacking their own thyroid. And we've done, in previous broadcasts, we've discussed how some doctors will try and use T4 with a little bit of T3 because they'll see that maybe a person is not converting their inactive thyroid hormone to active at the right rate. The studies have basically shown that that's not effective. And either you have to go with the T4, which is what most medical doctors use, or there's now studies coming out showing that if you use just T3, it can help people to lose weight. Yet most doctors are afraid to do that because there's a black box warning on your thyroid medication saying don't use this for weight loss. And if you are, you can see your doctor. So that's why you're not going to get T3 therapy for losing weight, even though it has been shown to help people lose weight.
Right. And to take one step back on something that I see as a confusion when patients come in. People are pretty clear when they have, well, they're not pretty clear. A lot of people come in and have been told that they either have Graves or hyperthyroidism.
Okay.
And I find that the majority of people who came in who were told they had Graves had Graves. They were tested for the antibodies and they had it. But the hyperthyroidism folks seem to be confused. Certainly part of the reason is because a lot of them didn't have hyperthyroidism. A lot of them actually had Hashimoto's and it was misdiagnosed. But you want to make that definition in there because we see that and it's confusing to the patient.
Absolutely. If you have Graves' disease, that means that your immune system is attacking your thyroid, but it's attacking with a specific immune cell, an antibody that attaches to the TSH receptor. So TSH comes from the brain to the thyroid, tells thyroid to make more thyroid hormone. So if your immune system is making an immune cell that binds to the TSH receptor and it looks like TSH, then your thyroid starts making lots of thyroid hormone. That is one cause of hyperthyroidism. It's the most common cause, but it's an autoimmune attack on your thyroid in a specific fashion that results in that. Now, there's also something called Hashimoto's, which is where your immune system can attack the thyroid, and the immune cells are not binding to the TSH receptor, but rather the immune cells are just killing the thyroid, and at times the thyroid will pour out thyroid hormone. It'll just dump it out, and that will cause you to present as being hyperthyroid, but you may have a lot of symptoms too of hypothyroidism. And so you really have to question your doctors, do I have Hashimoto's or do I have Graves' disease? And the critical test that you want to have run is like a thyroid stimulating immunoglobulin antibody test, or you can have the radioactive iodine uptake studies. These are tests that are typically done in an endocrinology office. But it's important to have this question brought up because we do see a lot of patients who come in, they have a low TSH, they're told that they have Graves, yet they're 40 pounds overweight and they're fatigued. Just so you know, that's not a presentation of Graves. A Graves patient is typically, their eyes are bugging out of their skull, they feel tremulous, they feel shaky, they have diarrhea, their heart is palpitating or they're having heart palpitations, their heart's over 90 beats per minute.
They're thin.
And they're typically thin. We have seen a few overweight Graves patients, but typically they are thin.
And so technically all three of those are an immune problem also. Okay. So the point being, the name of this is your thyroid problem really an immune system problem? you need to be much more careful with Graves. We co-manage Graves patients with their medical doctor because they can go into a thyroid storm, have heart problems, and so on and so forth. That's like the uber hyperthyroid reaction, immune reaction. But they are all autoimmune problems, and so they all have a similar approach.
Most of the time, yeah. And the reason why I didn't say in today's broadcast, your thyroid problem is an immune system problem, because there is that 5% window.
Yeah.
Exactly. There are other rare forms of thyroiditis, Riedell's, de Quervain's, or Quervain's, excuse me, not de Quervain's, Quervain's. And iodine deficiency still does exist in some parts of the world, but all of you out there need to get this. If you're living in an industrialized country, most likely you do not have an iodine deficiency. That's been well established. And we'll just hammer the point home again that if you are taking iodine because your alternative practitioner told you to take iodine, just know that there's study after study after study in the literature of people like you who take iodine and you make your thyroid problem worse, because your immune system is killing the enzyme that combines iodine with hydrogen peroxide to make thyroid hormone. So when you put more iodine into your system, it actually inflames the immune attack to the thyroid.
And when I tell that to people, they refer to me to one of the books that has been written on iodine. And here's what I tell them. Look in the back of the book and look for the peer-reviewed references. There are none. Okay. They're basically, this comes from a long time ago when people didn't even know Hashimoto's existed. They knew that iodine, the 3 and the 4 in the T3 and 4 is iodine. So it was like, okay, we'll give them more iodine. So please, I've had people argue with me over this. It's like, this is like pouring gasoline on the fire if you have an autoimmune problem. Okay.
There was a time in the mid 60s where there was an iodine deficiency in the Midwest because they didn't have any iodine in the soil. But since then we've iodized the salt. All of us, what do we need? Like a pinhead worth of iodine for a year. We're getting adequate iodine in our diet.
Exactly. Yeah. So to continue to draw, okay, so I just wanted to draw the fact that we're morphing into the immune system here. I mean, we had a brief conversation prior to this where, I said to Dr. Gates, technically, I tell patients, technically, this isn't a thyroid problem. Technically, this is an immune problem, because your immune system, if it's attacking that thyroid, it's probably attacking other things. And I think right before saying what I was just going to say, maybe we should go into the next area as to why it's all about the immune system. I could tell my story now about the rheumatoid arthritis patient who took steroids and her knuckles got better, and then she lost weight and her hair got better and her bowels got better, her constipation went away, and she started losing weight, and her thyroid swelling went down that she didn't even know she had. I had this thing here and it went down. I said, well, you have Hashimoto's, thyroiditis. And she goes, no, I don't. And I said, I had my thyroid tested and they told me it was normal. I said, you took a steroid, it calmed your immune system down, it calmed down the immune attack against the rheumatoid arthritis. But at the same time, it calmed down the immune attack against your Hashimoto's. Your thyroid started working temporarily. And so you've lost all of the symptoms of hypothyroidism. Oh, and her heart palpitations stopped too. So all the stuff from Hashimoto's lead into maybe a general story there. This story seems to help when I'm doing the consults for people to understand the concept that we're about to bring about, why it's all about the immune system. Is that relative to just us or the thyroid or both?
Well, I think your rheumatoid arthritis example is a perfect case in point. So is rheumatoid arthritis really a cartilage disorder, or is it an autoimmune problem? And the answer is it's an autoimmune problem with a secondary effect of the cartilage, just like multiple sclerosis. Is multiple sclerosis a brain problem, a neurological problem, or is it an immune problem? Really, it's an immune problem with the brain as the secondary effect. So in our society, we've been conditioned, and this is just the direction our healthcare system has gone, is that, well, if something gets damaged, we cut it out, we replace it, we give you a medication to replace what was lost. And then it's like end of story and people are happy. But in this situation of the thyroid, there still are a lot of unhappy people out there who are still suffering, still having symptoms, and you need to it's your immune system.
Right.
And they've done study after study after study where independent of your thyroid hormone levels, if you have hypothyroidism, You having these immune cells to your thyroid can create all the same symptoms of hypothyroidism, which is why that book that Dr. Krasian wrote was so just groundbreaking, because the immune system is the issue. It's not necessarily the thyroid hormones. Now, we're not saying not to take your thyroid medication, but we are saying is if you're taking your thyroid medication, you still feel like crap, then this is probably the reason why. And these are the things you need to pay attention to.
And feeling like crap means if you still have all your symptoms, but also if you're going to the doctor, he's telling you got hypothyroidism and you're thin, you probably have Hashimoto's. He's telling you, now there are exceptions, okay? There are exceptions, but in general, if he's telling you got hypothyroidism, you're probably going to be overweight and tired and things of that nature. Whereas whereas if you're thin or if you're thin and they tell you that you have hypothyroid, you probably have Hashimoto's. If you go to the doctor and you have all of the thyroid symptoms and your numbers are normal, you probably have Hashimoto's. If you're driving your doctor crazy, you come in and sit in front of me and go, my doctor doesn't want to see me anymore because I'm driving crazy. I don't even have to hear anything else. I can tell you they have Hashimoto's, but they're driving them crazy because the medication is not working. They're taking the medication religiously. The numbers are normal. They still have all the symptoms, or they have to keep dialing in the thyroid hormone because it keeps going up and down like a basketball. And that's another sign that you're probably dealing with Hashimoto's if you don't know it. And if you have Hashimoto's, like the gal came in last week, and you're going to an alternative practitioner or a hormone practitioner or whatever, and you have Hashimoto's and you don't know what it is, they haven't told you what it is, they haven't told you that it's an autoimmune problem, and it's being handled as though it's a hypothyroid, then you know you have Hashimoto's, but you need to listen to the rest of what we're going to say here. So there's a score of conditions that we treat or more that are related to Hashimoto's by its connection through the immune system.
Man, yeah. I mean, we can make this list 3 times as long.
Well,
this
I
is
know.
Just some of the new stuff. But why don't we go through it? I mean, let's just go off the cuff. Let's go rogue. So fibromyalgia, that's a common condition we treat where people have chronic pain, they have fatigue, they don't sleep well, they tend to have IBS. There's a huge association between that and Hashimoto's thyroiditis. Depression. We've talked about it in other broadcasts. Basically, they do studies in psychiatric facilities. Those who have unipolar, which is what most of you would consider as depression, or if they have bipolar depressive disorder, then 33% of these people, actually 32%, have Hashimoto's thyroiditis. And it doesn't matter what their thyroid hormones are, they have shown that these immune cells cause other systemic responses that can decrease blood flow in the brain, causes inflammation in the brain, and therefore the frontal lobes don't work as well, and that can be associated with depression. So go back and watch our depression and anxiety broadcast. Hashimoto's thyroiditis, as I mentioned before, is associated with weight issues. So they've done studies now where if they see signs of Hashimoto's independent of your thyroid hormone levels, 60 years later, you're probably going to be overweight. Independent of your thyroid hormone levels. This was a British study done in 1946
and not be able to lose it
after World War II. And that's been substantiated in other studies.
Right.
Peripheral neuropathy. Now, there's this element of peripheral neuropathies where people get numbness and tingling in their feet, burning, pain. They had this category called dysimmune conditions. So it's just like there's an autoimmune problem. Now Hashimoto's is falling into that dysimmune category with peripheral neuropathy patients. We can go further. Urticaria is a condition where people will get these like bumps, kind of like bumps. It looks like an allergic reaction on their skin, sometimes when they're out in the heat, sometimes when they take aspirin, sometimes when they sit on things. And this has a huge association with urticaria. Vitiligo, which some famous pop music stars have had and went through lots of plastic surgery to correct. So vitiligo is where your skin will turn white, and it can be more pronounced in someone who has a darker tone to their skin. And this has a high association with Hashimoto's, about 30%. Vestibular problems, balance problems. We just got a comment from a patient who is going to Johns Hopkins to have her inner ear disorder evaluated. They didn't quite know what was going on. Wrote this patient, attached a journal article where they showed that upwards, I think it's close to 50%. I can't remember if it's 44.8 or if it's 48% of Hashimoto's patients actually get damage to the inner ear. So if you have thyroid symptoms and you're kind of dizzy, this may be part of the reason why.
We had one yesterday.
Okay, perfect.
And it's going to be getting evaluated next week.
Perfect. Yeah. Then there's now associations between these thyroid antibodies and other antibodies to specific tissues in the brain, like the cerebellum. So attached to the article today, there's this thing called a GAD antibody. It's called a glutamic acid decarboxylase antibody, and it results in poor coordination and poor balance. We just had a little girl. I won't give any more specifics. She's not a little girl. She's over the age of 18, but just barely. And she has horrible balance problems, been everywhere, had thorough investigations. Turns out she has these thyroid antibodies, and that was a missing component.
There
to
are
her
days
case.
that she literally cannot walk. And then her day she's fine.
Exactly.
Because on the days where the antibodies are attacking her thyroid, they're attacking her cerebellum, and she can't walk. And she probably had a $150,000 workup.
Oh, at least.
We have all the data. That's how we know. That's how we know she has Hashimoto. It's because it was in the workup, but it's not being connected.
For
to
about
her
every
cerebellum.
inch thick is about $50,000.
Yeah, yeah, amazing.
But I mean, it was a lot.
Amazing. But if you got vertigo, or dizziness, vertigo, or balance problems that are not resolving, or they can't find anything, this is probably it. Or at the very least, this should be looked into.
In essence, because Hashimoto's is the canary in the coal mine. So for those of you who are not familiar with mining, miners would take a little bird down into the mine, and the canary would sit there. And if the canary fell over and died, it meant that there were toxic gases there. So the canary was kind of the sign that there was a problem. Hashimoto's in many ways not only causes significant thyroid symptoms, but it's a sign of other problems with the immune system, because usually this is the first one to occur. The tolerance of our immune system to the thyroid will break down first. I'll go back and I'll explain that. But going farther, that's why this patient or patients who have problems with balance, one of the first things they're saying to do is check the thyroid, because if you have thyroid antibodies, you probably have these other antibodies to your brain. Very, very important. What other ones do we have down here? This is a great one. So a new one came out where if a mom has Hashimoto thyroiditis, her risk of having a child with autism is substantially increased. So that's rather significant, since autism is now 1 in 68, according to the CDC. I mean, it just keeps dropping. It used to be way high, then it was 1 in 120, and then it was 1 in 86, now it's 1 in 68. They're now showing that these thyroid antibodies can cross the placenta. So we talked about in previous broadcasts, Hashimoto's has major implications for miscarriage, and this idea was kind of kicked around for a long period of time, and now the data is growing stronger and stronger and stronger that it is an independent risk factor for miscarriage, or a child not surviving after they're born. And what they're finding is that these immune cells that can be present in the mother actually get through the placenta and go in and can affect the fetus. So that's highly significant. And now there's discussion in the literature whether if a female has Hashimoto thyroiditis, irrespective of her thyroid hormone levels, maybe they should be treated with thyroid medication, because that's really the only thing they know what to do right now for these Hashimoto's mothers.
How many people have thyroid problems?
So it just keeps growing. We used to think it was 10% of females. Then it went to 18%. Then it went to 23%. Just attached an article to this broadcast today. 30% is the new statistic that they're finding of females who have Hashimoto thyroiditis. 30%. Just so you know.
And that's probably an underestimate.
Probably. The immune system should never attack us. We have millions of mechanisms, we've said it hundreds of times, in our immune system to prevent that from happening. That's called self-tolerance. Well, it breaks down, and it seems to break down to the thyroid most commonly. So now we have 1 in 3 females out there running around with Hashimoto's thyroiditis, and it can affect all these things. And we have an obesity epidemic in our society where 1/3 of the population is overweight, 1/3 is obese. We have all these issues with, neurological disorders like we're talking about. Miscarriage is a major, major problem in our society. Depression affects 16%. Did you mention brain fog,
short-term memory?
Yeah, so poor cognition, that's associated with Hashimoto's thyroiditis.
Did you mention celiac?
I didn't mention celiac. So
celiac.
So those two, basically if you have celiac, you have a high probability that you're going to have Hashimoto's. Celiac's where your immune system attacks gluten. If you have Hashimoto's, you have a high percentage or high likelihood of creating antibodies to gluten, but that won't be celiac disease, but you're still making antibodies to gluten. You can see that this Hashimoto's is just this major entity causing a lot of havoc within our healthcare system, and it seems to be poorly understood, and it's not quite managed the way we think it should be managed. across the board.
Yeah, and it's not. It is a huge part. If you have fibromyalgia, chance of you having Hashimoto's is like you're like Hashimoto's until proven innocent, basically. You know, and I mean it is unbelievable how much this has to do with chronic pain. Just think about it. Your thyroid gets attacked. Your thyroid has receptor sites in almost every cell in your body. It runs your energy levels. You're either high or you're low. It's one of the major reasons that people get gallbladders out, because the gallbladder starts to slow down. Everything starts to slow down. It can slow down everything. It can slow down your ability to make red blood cells and cause you to have that unknown chronic anemia that you can't get rid of. I mean, we have seen it all. And if you just trace out the physiology, it starts to make sense. Constipation. Why would you have constipation? Well, everything slows down. And it's just like dominoes falling. Now the gallbladder starts slowing down. The gallbladder starts going like this. Oh, well, your gallbladder is just not pumping right. So maybe we should take it out. No, let's wait until it's got stones. That's fine. Or, I mean, you should wait until it's gangrenous, because if you know this, you can get something done with your gallbladder. But the point being now, or your bowels slow down, your bowels slow down, and you get constipation. And now as that sits there, now you're going to start getting leaky gut. You're going to start getting food sensitivities, which, by the way, in turn screw up your Hashimoto's thyroiditis. It's crazy. And then if you have Hashimoto's, this point I wanted to make, most people are coming in here, and when I'm digging, when the person hasn't been informed yet, or when I see they have Hashimoto's in their file, like last week, and they don't know it, my first question is this: do you have heart palpitations for no reason at all? And here's the answer I get most of the time: not a lot. It's like either a yes or a no answer, right? It's like, well, what's not a lot? Well, a couple times a month. Well, eventually that couple of times a month is going to become more. But if you have undiagnosed anxiety, if you have tremors, if you have night sweats, these can be other things, okay? But you put together heart palpitations with night sweats, you put together a little anxiety issue, you put together insomnia, you put together I'm losing weight for no reason at all, and you're not even thinking thyroid, okay? You probably have Hashimoto's. There is a substantial chance that you have Hashimoto's. So these are the practicalities that you should understand. I don't know if we should be even going into this, because people who are looking up Hashimoto's probably already know that they have it. But just to give you a little bit more of a general clinical parameter of what's going on there. And so, yeah, it's just huge. It's just, it's impossible to understate the importance of this if you have a chronic pain condition that's not going away. Migraine.
Yeah, very high association.
Migraine. Did you say migraine?
I did not say migraine.
I mean, migraine. This guy's like the migraine guy of the universe. Like migraine. I just had one, exactly. Clearly. Right. And the guy's got Hashimoto's, right. And he's got chronic migraines, and you got a stress mechanism going on. You have like a chronic stress issue, and you have the same symptoms I just got done talking about. You have a chronic stress issue, and you've got a little anxiety, and you got a little heart palpitation. Well, if you have that, if you have like post-traumatic stress syndrome and you got Hashimoto's, I mean, you're the person who's ended up in the hospital with your heart like ripping out of your chest, and they do a heart evaluation on you, and they go, everything's normal. Here's some electrolytes. Go home. Meanwhile, you're freaking out, going, what the heck's happening? You probably have Hashimoto's on top of that post-traumatic stress syndrome that you have. I hear it all the time. And when I say all the time, I mean, like when I say all the time, several times a month, I'll hear, I mean, we see like we see more than that with consults, but I mean, several times a month. I hear that probably once a week. I hear about, yeah, I did go to the hospital. Yeah. Usually the husband and wife sitting there, and I'm saying this as I'm looking at their chart, and I see the husband going, like, is this guy like clairvoyant? Like, has he been following us around? No, this is, it's amazing. I mean, how many hospital visits is this? Oh yeah. Is this responsible? 150 grand, we estimate that workup took from a very major hospital back in the Middle East. 150 grand. Midwest. And Midwest and in the Middle East. And I'm looking at this thing, and I go, oh. Mm-hmm. Doc. Did you see this? Yeah. And there it was. Mm-hmm. And there it was. And for sure, it's what's gonna help this gal, for sure. Mm-hmm. So prevalence of these antibodies is
is very high, 30% of females. I mean, it just keeps growing. And then also it's important to point out that the high value for these antibodies has been disputed throughout time, and it keeps coming down. Now the Mayo Clinic is saying anything over 9 for the thyroid peroxidase antibody.
Oh, 9, yeah. So a lot of you are being told you don't have it to have it.
Exactly. 9 international units per milliliter. Anything over that is too high. So labs can vary though. For example, LabCorp here in Reno, they say anything over 34 is too high. But the Mayo Clinic is saying 9. Our local hospital, to my most recent knowledge, says 9 because they use
last
the
couple of weeks
ARUP laboratories as their gold standard. A lot of labs in California are saying 9 is the high value. So you may get a lab done and they say, it's just a little high. You know, maybe you're at a 12 or maybe you're at a 14. Well, that's significant in our world. That means you have it. And by the current research studies, they're showing more and more people have this problem. And I think by now you understand the systemic effects of it. And a lot of people want to know, well, what can I do? There are Hashimoto support groups out there. They're talking about taking selenium. We're not adverse to these Hashimoto support groups. It's good that people get online and talk about what they're doing in terms of treatments. But we attached an article today showing that selenium really does not seem to help Hashimoto's patients. We've tried selenium supplements. We can't tell you everything we've tried. We have tried so many different products from so many different supplement companies touting that they had the cure for Hashimoto's. And frankly, they didn't. And
it's
Hashimoto's
multi-dimensional.
Exactly. It comes down to a few tenets. One is the gut. We're finding that certain foods look like the thyroid. So maybe you eat gluten and gluten looks like the thyroid tissue. So if your immune system attacks gluten, your thyroid tissue gets attacked. Gluten was just the tip of the iceberg though. It's now being postulated that there are several different foods. In our experience, we've seen several different foods from our testing that can affect the thyroid. Then there's also the component of, like Dr. Rutherford said, why are the foods getting through your
and they're different foods for different people.
Exactly.
It's not like I can give you the list of 7 foods here.
Yeah.
Okay.
Good point. And then why are these foods getting through your gastrointestinal tract? So that raises a question, do you have leaky gut syndrome? So go watch our broadcast on leaky gut. Then there's association between stress hormones and autoimmune thyroid disease. So we've talked about that in previous broadcasts in detail. Then there's an association with viruses in the thyroid. So now we're seeing that at least 3 different viruses can live in the thyroid gland of Hashimoto's patients 80% of the time. We have Vibrio viruses, we have HHV6, and we have Epstein-Barr virus that have been found in the thyroid gland. So it's rather important to evaluate all those things as well as vitamin D status. There are now studies showing that you can maybe drop your thyroid antibodies by 20% by taking vitamin D and getting your vitamin D into an accurate range. But again, everybody wants one thing for one problem. That's our society, that's our culture. And hopefully you can see that this is multifactorial. It takes a multimodal approach, so to speak, to handle Hashimoto's case. We've had Hashimoto's cases go through our program where we change their diet and all of a sudden their thyroid lab values come back down the range. We've had a lot of patients where that wasn't the case. We had to take care of the diet, we had to take care of the stress levels, the vitamin D, and the viral issues, and only then did their thyroid levels come back into normalcy.
Right. So the medical model is basically for the managing the thyroid stimulating hormone. So this is not a thyroid stimulating hormone problem. Now you did mention that and I mentioned that to tag on to that tale about the lady who had the rheumatoid arthritis. Basically, she said, Dr. Rutherford, can you tell me why I'm losing weight and my hair is getting better? I thought steroids, which I'm taking for my rheumatoid arthritis, is supposed to make me bloated and have all these terrible side effects. And the fact was it was calming the immune system down, or crushing it, if you will. And it was stopping the immune attack against her cartilage. And it was stopping the attack against her thyroid. So I'm actually not sure why they don't think of the thyroid that way. I'm sure they have reasons for it. I don't know what they would be. You would think that the Mayo Clinic communique might say, well, 85% of these subclinical hypothyroids have antibodies against them. Let's try a thyroid. Let's try our standard autoimmune therapy. But they don't do that. But they are they're trying to come up with something. But I was thinking about this after you told me. Still, you want to find out what these other things are.
Exactly, because Hashimoto's will lead to other autoimmune problems going on in your body. So just like we said, this gal who has poor balance, Hashimoto's is the sign of what's going on, but she has bad balance because she's making other antibodies associated with the Hashimoto's to her brain tissue. Just like the vitiligo patient, they're making other immune responses to their skin. And the urticaria patient's making other immune cells, or they're creating IgE responses that create allergic reactions. So you want to get to the cause of the problem. Just as Dr. Rutherford is saying, we brought up an article in today's broadcast where they're making antibodies to the thyroid antibodies. So take a step back. Most of you have probably seen a Humira commercial online or an Enbrel commercial. These are new medications for autoimmune disorders like rheumatoid arthritis or psoriasis, where they give them to you, and these drugs are antibodies basically to immune cells to calm down the autoimmune attack. Well, they're now starting to postulate or starting to look at this same model for Hashimoto's, but this is the first time we've seen it. And we're not anti-medicine, we're not anti-endocrinologists, but what we're for is getting to the cause of the problem in this situation, especially in light of the fact that there are a lot of people out there who are still suffering with thyroid symptoms and other Hashimoto's related symptoms that are not being handled. So that's why it's important to get to those main tenets that we talked about.
Yeah, and the long-term effects of these drugs.
And lots of times Humira and Enbrel, they're not necessarily the cheapest drugs on the market.
Not cheap, there's side effects. If you don't know about what we just got done saying, you have to consider the trade-off. If the trade-off is worth it, then the trade-off is worth it. But this is the way to go.
Okay, so I think we pretty well summarized it.
Okay, so that's Hashimoto's. And if you have any comments, we're happy to take those. If you have any suggestions for future topics, we're happy to take those. You can look at our website, powerhealthtalk.com, and scroll down to Hangouts for any of the subjects that Dr. Gates alluded to. And we're just trying to get this out. I was shocked to find out that we didn't have a presentation that actually was titled Hashimoto's. Turns out we did have one, but it was back in March of 2014. But hopefully this will give the data out there that I think needs to be gotten out. Please review the attached references for validity, and hope that this was a valuable piece of information for you. So we'll see you next week. Thank you again for watching.